Hello and welcome to the Bazooka. This is a series on my YouTube channel where we look at 10 OSCE stations in one clinical course. Today we shall be looking at the season finale for obstetrics and gynecology and indeed concluding our examination week on the channel. If you haven't yet subscribed to the channel, please subscribe to the channel, drop a like, drop a comment, share the page, and get ready for X-ray week because it's coming in the coming weeks. Tell a friend to tell a friend. My name is Dr. Moses Kazevu. Grab your piece of paper, grab your pen, and let's go. Station 1. So shown is a picture, and question A is, what are the indications for oxytocin use in obstetrics and gynecology? Part B, adverse effects of use of oxytocin. So I will give you 2 seconds to think through this question. And here comes the answer. So oxytocin could be used for induction as well as augmentation of labor. It can be used in the active management of the third stage of labor. It can be used to prevent and even treat hemorrhage that's often due to incomplete abortions or postpartum hemorrhage. Then some adverse effects of oxytocin include things like arrhythmias, headaches, disseminated intravascular coagulation, which is a bit rare. You may get some anaphylactoid reactions, so it may cause dyspnea, hypotension, or shock, especially when given as a bolus. In low doses, it may cause uterine spasms, and then in much higher doses, it may cause uterine hyperstimulation, which may lead to fetal distress, asphyxia, death, and sometimes even tetanic contractions of the uterus that may lead to uterine rupture. And with higher doses, you may result in water intoxication and hyponatremia because of water retention. Remember that oxytocin has a similar structure to antidiuretic hormone. Station 2 is another picture of a drug. This time it's magnesium sulfate. How is the loading dose of magnesium sulfate given for preeclampsia on labor ward? What parameters are monitored on patients receiving magnesium sulfate? What is the antidote for magnesium toxicity? I will give you 2 seconds to think through this question. And here comes the answer. So there are 2 regimens that can actually be given. There's what is known as the pre-chart regimen, and there's what is known as the Zuspan regimen. The pre-chart regimen is what we use currently here. So that's the one I'm going to give you. So you give a loading dose of 14 grams, and it's given as follows. You give 4 grams IV, is intravenous over 3 to 5 minutes. Then this is followed by 10 gram deep IM. So you give 5 gram in each buttock. And the parameters that you often check for is the urine output. So you should ensure that it's greater than 30 mils per hour. The respiratory rate, which should be greater than 12 breaths per minute, and the presence of deep tendon reflexes, like for example the knee jerk. So if these 3 parameters are not met, then you should stop administering the magnesium sulfate. And of course, your antidote is calcium gluconate, about 1 gram over 10 minutes. Moving on to the next question, which is also a picture of some pills shown on the screen. List 5 gynecological uses of the oral contraceptive pill. What instructions would you give a patient who misses the pill for 48 hours? So I will give you 3 seconds to think through this question. And here comes the answer. So contraceptive pills, combined oral contraceptive pills, or just oral contraceptive pills, can be used in the management of conditions like endometriosis. They can be used in the management of menorrhagia or dysfunctional or abnormal menstrual bleeding or uterine bleeding. They can be used in the management of dysmenorrhea. They can be used in gynecology in preventing pregnancies. They may be used in the management of polycystic ovarian syndrome. They may be used in the management of molar pregnancies during the follow-up of a patient after treatment. Then what instructions would you give the patient who misses a pill? So there are some criteria that are actually used. So if a person misses 1 pill, that's about 48 to less than 72 hours since the last pill that they're taking on in the current pack. If they are in week 2 or week 3 of the hormone-free interval or the subsequent consecutive weeks of the continuous pill taking, then these are the following advices that you're going to be giving the mothers. So emergency contraception is not often required if she has been consistent and if she has been using it correctly in the previous 7 days. And you should advise her to take the pill that has been missed as soon as possible, and to also continue taking the remaining pills at the usual time. So it means that there'll be a time where she'll be taking 2 pills in 24 hours, the missed pill plus the next one at the usual time. And there is usually no additional precaution that is required if she was consistent. But if she wasn't consistent and she wasn't really taking the pills consistently the past 7 days, then you would advise her to have additional contraceptive methods. Now, if she's missed 2 to 7 pills that have been missed, that's more than 72 hours or more. These are the following advice. So you take the most recent missed pills as soon as possible. You continue taking the usual pills and the remaining pills in the usual time. You avoid any sexual intercourse, or if you were to participate in sexual intercourse, you would have to use barrier methods, so pretty much condoms. And then, of course, consider a follow-up pregnancy test, because this woman would be pregnant, especially if she's had unprotected sexual intercourse. Moving on to the next station, identify the item, mention 2 maternal and 2 fetal indications for this procedure done using the above instrument. Mention 5 contraindications for this procedure. So I shall give you 2 seconds to think through this question. And here comes the answer. So this is obviously suction cups for vacuum assisted delivery system or ventouse delivery. Some maternal indications include previous C-section or genital prolapse repair. You may have some medical maternal disorders such as heart disease, hypertensive disorders, moderate to severe anemia. You may also have inadequate maternal effort. Then fetal indications include a non-reassuring fetal heart trace. You may also have a prolonged second stage of labor or a failure to progress to the second stage of labor. Then mention 5 contraindications for this procedure: encephalopelvic disproportion, CPD, when the fetal head is not engaged, if the gestational age is less than 34 weeks, and if there's a known fetal condition that's affecting the bones, or this fetus has a bleeding disorder, and then if the fetus is in non-cephalic or facial presentation. Station 5, name the instrument shown above. Name the labeled parts of the instrument. Give 3 common gynecological uses of the instrument. So I will give you 2 seconds to think through this. And here comes the answer. So this is obviously a manual vacuum aspiration instrument. So part A is pretty much the valve, and then part B is pretty much the plunger. I gave a much more descriptive labeled diagram in the next slide, so just pay attention in the next slide. Then it can be used in incomplete abortions. It can be used for abnormal vaginal bleeding, even in molar pregnancies. So here's a much more labeled diagram. Here you have a cap. Here you have the latch. Here you have the valve button, you have the valve itself, you have the plunger O-ring, you have the cylinder, you have the clip, you have the cylinder base, you have the collar stopper or the collar stop, and then you have the plunger handle. And then of course these are cannulas, or cannulae rather for plural. Station 6, name the labeled items. So I shall give you 2 seconds to think through this. This should be very easy. If you haven't yet subscribed to the channel, please subscribe to the channel. Hit the bell notification icon so that you do not miss any updates from the channel. And here comes the answer. So instrument A is of course an umbilical cord scissors used to cut the umbilical cord. The part B here is a penguin sucker. It's even shaped like a penguin. I mean, the answer is right there on your screen. So it's a penguin sucker, also for penguin suction. Then C is an episiotomy scissors. Then station 7, list any 3 available methods for cervical cancer screening, 10 marks. I think this is a little bit too excessive for just listing. But anyways, I will give you 3 seconds to think through this. And here comes the answer. So obviously you could either do a pap smear or a pap test. Remember, if you followed the videos on MK's Exam Secret, a similar question was asked on this. So if you want to find out details of this question, please visit that video right after you watch this video. Then you may also do an HPV DNA test. This is a type of PCR. You may also perform visual inspection under acetic acid, which is pretty much vinegar. Then station 8, describe the steps in active management of the 3rd stage of labor. I will give you 2 seconds to think through this question. And here comes the answer. So obviously you want to check for the presence of a second baby in the uterus. And then if there's no baby in the uterus, you inject oxytocin 10 international units preferably, or you could use methadone 0.2 milligrams IM on the thigh. Avoid methadone in hypertensive patients, and then this should be done within a minute of delivery of the baby. So the placenta is expected to be delivered soon after delivery of the baby. If the placenta is not delivered thereafter, then it should be delivered with what we refer to as controlled cord traction, or Brand Andrew technique. So after clamping the cord while the uterus remains contracted, then you can apply support to the perineum and make upwards and downwards motion, removing the placenta. And as the placenta detaches and is about to leave, make some twisting motions to ensure that it completely separates from its wall. Then after delivery of the placenta, you should immediately start your massaging of the uterus. You should examine the placenta to make sure that it's complete and none of it has retained in the uterus. And then of course you should examine the woman's vagina, perineum, and external genitalia for any lacerations or indeed any active bleeding. Station 9. What is the name of this investigation? What is the main indication for this investigation? Label the parts A, B, and C. So I shall give you 2 seconds to think through this question. And here comes the answer. So this is obviously a hysterosalpingography, and it's most commonly used in infertility, where we are able to judge whether there is a partially or fully blocked fallopian tubes. Then name the labeled parts A, B, and C. So A are both the left and the right fallopian tubes. B is the uterus. C is the spillage of the dye. And let's move on to the last question. So Mrs. Sandra Katema, a 24-year-old woman, G2 para 1, at 39 weeks gestation, presented in labor on the 13th of April 2021 at 12:30 hours. She was contracting every 2 minutes, so keep that in mind. So it means that if she's contracting every 2 minutes, in about 10 minutes she has 5 contractions. She looked comfortable. Her contractions lasted 18 seconds. Vertex presentation with descent 3 out of 5. Fetal heart rate was 140 beats per minute. On admission, the cervix was 4 centimeter dilated. Membranes intact, no kaput or molding. She progressed to 6 centimeters in 6 hours. There was clear liqua, no molding and no kaput. The contractions were about 3 in 10 minutes, lasting 25 seconds. The fetal heart rate was 130 beats per minute. And the estimated fetal weight was 3,000 grams. The pelvic was adequate on examination. Her BP was 125 over 80 millimeters of mercury. Pulse was 82 beats per minute. Temperature was 36.4 and the urinalysis was normal. So use the pantograph provided to plot the findings on assessment. Part B, what is the diagnosis after the 6 hours of monitoring? Part C, what are the possible interventions needed for the patient? So I will give you 5 seconds to think through this question. And here comes the answer. So I will zoom this a little bit so that we can follow through each and every single section of this pantograph. So above here, you have your demographics. Here you have the fetal heart rate, you have the liqua and molding, you have the cervical dilatation here in centimeters, descent of the head, you have contractions of the uterus, you have oxytocin, international units per liter, as well as drops per minute, drugs that are given in IV fluids, you have the maternal pulse and BP pulse, you have the maternal temperature, you have the urinalysis findings here, the proteins, acetone, and the volume of the urine. So remember that this woman, you fill in her name, so it's Sandra Katema. She's G2 para 1. She came into Levi Manawasa University Teaching Hospital. Her date of admission was the 13th of April, and her time of admission was 12:30 hours. Remember, this woman came in at 4 centimeters dilated. Remember that the pantograph is often opened at 4 centimeters dilated. That's where you start your plotting from. So you're going to start your plotting at 4 centimeters here. So this is in the active phase of labor and not really the latent phase of labor. So here she came in at 4 centimeters. So you mark an X over here. Then after that, the descent was 3 out of 5. So you mark an O here. So you have your X here and you mark your O here. Your fetal heart rate at this time, I think this was a typo here. It should have been placed here. So your fetal heart rate at this time should have been 140, which is placed here. The membranes were intact. So you put an I over there and there was no molding that was present. Then at the same time, remember she was having contractions every 2 minutes. So it means that in 10 minutes, she should have had 5 contractions. And these contractions were about 18 seconds. So if the contractions are lasting less than 20 seconds, you put dots. If they are between 20 to 40 seconds, you put these lines. If they are greater than or lasting longer than 40 seconds, you usually shade it entirely black. So that's why we're shading 5 contractions over there with dots. And then they didn't give us any information of the temperature, blood pressure, pulse, or any urinalysis at this stage. Then 6 hours later, so if we count from 12:30, 1, 2, 3, 4, 5, 6. So 6 hours later, that's around 18 hours 30. The membranes ruptured. We're not really sure if they ruptured at that time, but we shall assume that they ruptured at that time. Then the liquor was clear. There was no molding. The heart rate was at 130. So you plot that at 130. The cervical dilatation was at 6 centimeters. So it's past the alert line. It's going towards the action line. So you plot that here. Contractions were 3 contractions in 10 minutes, and these contractions were lasting 25 seconds. So you mark that on your patograph over there. Your blood pressure was about 125 over 80. Your pulse was 82. So you mark your blood pressure in that manner and your pulse in that manner. And then, of course, your temperature is 36.4. There was a normal urinalysis. So it means there were no proteins. There was no acetone or ketones that are present in urine. So this is how you're going to pretty much roughly mark your patograph, though there are some findings in between and some monitoring that should have been done in between to make it a much more complete patograph. So what is the diagnosis after 6 hours? So this woman is on the right side of the alert line. So ideally they should be on the left side of the alert line. That's how you know that everything is progressing very well. But if they're still on the right side in between these two lines, that means that there is a prolonged active phase of labor. So most likely there's a prolonged active phase of labor. Now, because this woman has an adequate pelvis, so you could actually augment the labor because even the contractions have reduced. So you could augment the labor with oxytocin. You may also perform assisted delivery. But then I think assisted delivery, she should be fully dilated. So scratch that out of your mind. So we just administer some oxytocin that may be present and keep on monitoring. If she goes past the action line, then possibly you need to take this woman for a cesarean section. Or if there are any features of fetal distress, if the heart rate falls below 120, take her for cesarean section. If there's any presence of any molding or any meconium in the liquor, then take her for cesarean section. Thank you for powering through exam week on the channel. I've really had so much fun teaching you these things. I hope you had as much fun learning about them. Please subscribe to the channel if you haven't subscribed to the channel. Share the page, drop a comment, drop a like to Zambia and beyond. And tell a friend to tell a friend that next week it's going to be X-ray week on the channel. God bless. My name is Dr. Moses Kazevu. Until next time,